It's Sunday night and it's time for The Fix.
Tonight's big hitter, Health Minister Motsoaledi. Is he delusional or can he make quality, affordable healthcare a reality for all?
The rich must subsidize the poor. The young must subsidize the old.
In the look ahead, our expert panel unpacks whether our health system is in the ICU. In the cool stuff, I explore how art imitates life with sculptor and activist Harun Sali. The Fix starts now.
Good evening and welcome to The Fix. Let's start with this week's big hitter. Welcome to The Fix. This is where every Sunday night, without fear or favour, we question the big hitters. We look ahead to tell you what will matter on Monday. And we go beyond politics and look at the cool stuff South Africans are doing. We begin with tonight's big hitter, Health Minister Motsoaledi. Good evening, Minister. Welcome to The Fix.
Good evening, Karima, and thanks for having me.
Well, you're the man of the moment since your announcement that the NHI bill, amongst others, will be gazetted. But you're also on record as saying the health system in South Africa, the public health system, is not in crisis. Let's take a look quickly at how the President sees the matter. Now, of course, many in South Africa says that it's not doctors and nurses are fleeing a crumbling public health system. Minister Motsoaledi, how will you convince them to stay? We'll come back to that bite of the President and the issue of the health crisis.
Karima, the word in contention here was a healthcare system that has collapsed, which means it's no more. It's not working. We were not denying the fact that is under severe distress. There are crises in quite a number of areas. Otherwise, we won't be asking for changes.
Absolutely.
In NHI. So the contention here was, has it collapsed? Meaning understanding that it's no more there.
Okay.
That was the main issue. And I think maybe we should go beyond that debate because...
Okay, but let's listen to the President quickly. He was addressing the National Union of Mine Workers. That clip is up.
Right now, our hospitals are bearing a huge burden, and our health is in crisis.
That's, of course, Cyril Ramaphosa, their minister, saying unequivocally that the system is in crisis. Now, the reason why it's important to define what we have is because you are suggesting these huge changes. So, in a word, do you agree with the President? Should I believe you or the President?
No, you are talking as if I've ever argued against anybody. The whole argument when it started, starting from the time I was asked about what the unpack said, was the word collapse. Never, it was not about the issue of whether there are big problems, whether you call them a crisis, and I said it's in severe distress, it's overburdened. So the issue was collapse because I was understanding collapse to be meaning it's no more. Services are no longer being provided for anybody. For instance, like...
But Minister, words are important, right? And it's important for us to be precise about words. In your own words, are you describing our existing health system as one in crisis?
Well, I said it's in severe distress. In some areas, that distress can be characterized as a crisis, yes. I'm not denying that. But I use the word distress because it's very heavily distressed. And some of the distresses can turn into crises.
Okay.
And I'm repeating, the word under contention here was collapse. And I even gave an example that when there was a big problem in Northwest, some health facilities were closed altogether. Nobody could be treated there. And that's the one I understood and characterized as a collapse.
Now, Minister, of course, you are informing the public, you have been informing the public that the National Health Insurance Bill will, of course, be gazetted together with the Medical Schemes Bill. And this will obviously bring fundamental change to our health system and the way in which people experience it. It's also brought a lot of uncertainty for many people. What is the major aim of this system over and above the fact that we need to make affordable and quality healthcare available to the majority of people?
Well, the main aim of the system is that we need to have a system that can provide access to good quality healthcare for all South Africans, not for a selected few.
How?
As it's happening now. So, by putting up together a common pooling of funds. Even the National Development Plan says so. They say for the country to provide good quality health care, access to good quality health care to all the citizens, the only way to do that is to have a common pool of funds. Don't separate people into different pools depending on their socio-economic status. Because when you do so, you are also dividing them in terms of skills. For instance, there are 16% of the population in our country. These are mostly people who have got medical aid. Some put it at 17%. They have got access to two options in the healthcare system. They can go to a private hospital using their medical aids. When their benefits are exhausted, they no longer have anything.
So if they are on medical aid and you introduce the NHI, how will it affect them? Will they still remain part of the private medical aid scheme, or will they have to give that up to be now part of the NHI?
No. Our proposal is that NHI, like all universal health coverage systems around the world, is mandatory. Because there are only 3 ways in the world of financing healthcare. We don't know any other 4th way. If somebody has got a 4th way, maybe they could advise us, but we only know 3. It's either you pay cash, like you are in a supermarket for anything you need, whether you need a packet of pills, whether you need your ears to be checked, whether you want your BP to be taken or diabetes, or whether you are put on the table for some procedure, you pay cash. That's the first method. The second method is what is called prepayment of healthcare, but it's voluntary, meaning you pay for your health even before you are sick, but you do so voluntarily.
Okay,
that
Minister,
is what medical...
hold that thought. We are, of course, here on The Fix, encouraging contrasting views. When we come back, Sunday Times columnist Peter Bruce and I will press for all the answers.